Today's hero of the season, Dr. Warwick Sultan. Sir.
Is visible? Yeah, thank you so much. First of all, thank you so much to the Zydus Wellness for inviting me in this symposium. Basically, this is a evening symposium on Saturday evening, and I think this is a houseful on Saturday evening. And my regards to all the dignitaries like Shupriya ma'am, Dr. Rekha Srivastav ma'am for attending these sessions. And this is a very important topic that I would like to shed the light on about the optimizing muscle nutrition with a dynamic duo of the high protein nutrition with the prebiotics and probiotics. We used to call about the symbiotics effects. I need a slide changer, please. And change. And change. Well, anyway, so I will ask Vishwajit to change the slides and all. So this is the protein intake in India. So why protein intake in India is very important? Because as ma'am said that protein is a very vital, important macronutrient we need all of us. There are several roles of the protein. First of all, the role of the protein is for the muscle development, for the bone development, of the hormonal function, enzymatic activity, and all the important like immunonutrients, all the important like antibodies and all the important immunoglobulins, all that depends on the protein. So protein should be the ideal macronutrient part that we all need very well. That's why, but in Indian diet, what we can see, that protein is very depleted. What we can see in our plate, the max amount of the carbohydrate rich diet with a lot of rice, but you can find only the one piece of chicken. But a lot of rice and lot of other cereals, and you can see one or two pieces of chicken. So in that cases, there's a protein deficiency is happening in the India. That we all know in the community level that we can see the kwashiorkor, marasmus, marasmic kwashiorkor, protein energy malnutrition are very common. So in that cases, what's the importance of the protein? Importance of the protein we need on daily basis. The importance of the protein we need in our body weight, like if our body weight like 60 gram, then we need at least 1.2 to 1.5 gram into 60 gram. So 1.5 gram of protein would be the ideal ratio for everyone we should take on daily basis. Apart from there are some other issues like decompensated fatty liver or the CKD or the AKI, that is something different. But protein balance should be there, this is number one. And these the protein, we have to calculate the chemical score, the net protein utilization, the biological value of the protein, because protein is the good protein or the protein is the bad protein, and how do you utilize the protein. Because cooking mechanism is simultaneously important, how we can retain that X amount of the protein, that is very, very important. So protein balance and the protein requirement are very important. So deficiency of the protein like muscle atrophy can happen, brittle of hair loss, like brittle hair and the nails can happen, increased use of the stress factors can happen, mood and the cognitive impairments can happen, and also weakness of increased hunger can happen. So all the things are very related with the protein. So that is very, very important that we have to take care of the protein balance. So 73% Indians are the protein deficient, what I have already discussed. 90% unaware about the daily protein requirement. What about your morning diet? আমি তো খই খেয়েছি বা আমি তো মুড়ি খেয়েছি বা মুড়ি জল, there's hardly we can get the protein. Maybe some people have the ruti aloo tarkari, hardly they can have the protein. Maybe some people have the rice and the vegetables, hardly we have the protein. So in those cases, Bonani, can you please sit over here which is the slides. So that is very, 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 very important that we can see. So the next slides. So adequate protein intake recommendations for India. So what is the adequate protein intake recommendation in India? What already said, at least 1 to 1.5 gram per kg body weight with 25 to 30 grams of protein in the each meal. So if we segregate of the meal like our early morning till dinner, then what is the protein percentage we can get on each meal? So the protein calculation is very important. Like maybe in morning breakfast we can have the egg white or chana. In the lunch timing maybe sometimes we can have the fish or chicken or any kind of other veg protein sources like tofu, like soya, like paneer and other stuff. In dinner also we can have the chicken or fish. So segregations of the proteins are very important. So in the cases we need to have the this kind of session, that adequate protein intake recommendations for the adults, what we need for the Asian population. So that we have to highlight the protein importance in the daily diet. Next. So here we can see the life force changes in the muscle mass and the muscle strength, where we can see the lifestyle habit is very important, like lifestyle habit like impaired nutrition, reduced physical activity, too much of the alcohol consumption, too much of the tobacco consumption, cigarette smoking is very important thing, and genetic factors like IGF-1 and vitamin D receptor genes that contribute to the various of the skeletal muscle mass strength. So in the cases we can see the peak muscular mass of the strength of this strengthening achieved, where we can see the achievable mass in the early life, where you can see the adult life and the older life. What Madam also told about the sarcopenia, the geriatric phases, more than 50 or the 60 years of the old, sarcopenia can happen. Nowadays, what we can do with the diet prescription calculation, we do the DEXA method. Sometimes we can the body impedance method. Sometimes we can do the in-body measurements, where not only the BMI, but also we can see the percentage of the lean body mass. Maybe our people are very thin, but you can see their tummy part or abdominal obesity is much more higher. So there is the sarcopenic obesity. Maybe if you see the BMI score or the BMI score, then you can see the fat percentage is much more higher, and also the bone mineral density is very low. So in that cases we have to take care about again the protein part. So in the any kind of fat reduction of the fat part, what we can see that the muscle loss is not required. Always we can go for the fat loss. So fat loss is a very important thing, muscle loss is not. So muscle loss shouldn't be there, that we have to go. Next. So prevalence of the irritable bowel syndrome in India ranges 4% to 7.5%. Yes, we can see after the COVID or also the pre-COVID also, we can see that a lot of patients are suffering from the irritable bowel syndrome. Maybe some people have the ulcerative colitis, maybe some people have the Crohn's disease. So there are a lot of problems. We used to prescribe the low FODMAP diet to the such particular aspect of these patients. But in the cases also, the prevalence of the obesity and the abdominal obesity, like the visceral fat, where you can see the android fat or the gynoid fat is much more higher. So that is 13.85 to 57.71%. And 5 to 6 out of 10 women between ages of 30 to 49 are abdominally obese. They are the obese, but they are abdominally obese. And the prevalence of the osteoporosis and the osteopenia. Osteoporosis is much more higher of the post-menopausal women or the above 60 years of the women, and is much more higher respectively in the hypertension and the diabetes and the common comorbidities. Like syndrome X is much more higher, where you can see already she told about the non-communicable disease like diabetes, cardiovascular problem, hypertension and other metabolic issues can happen on this age. So chronic health condition in the Indian adults with the major predispositions, on top of this is the higher part that we have to take care. Next. Factors affecting muscle health and the role of nutrition or nutrients. The functions of the muscle protein. Why? The reincorporation of the amino acid into the muscle protein. We all know we have the two kinds of amino acid, essential amino acids and the non-essential amino acids. But the 9 essential amino acids are there, where our body can't produce such kind of amino acids. So we should depend on the outer dietary sources for having this kind of amino acid. And what are the non-essential amino acids? Non-essential amino acids our body can produce, and we have to utilize on this kind of amino acid. So this amino acid is very important. So amino acid in the muscle protein, the role of the muscle protein of the amino acid are simultaneously important, because we all know very well about the ATP cycle, NADP to NADPH, and the utilizations of the ATP in the mitochondria. We all know about the Krebs cycle. In the Krebs cycle formulation, but the protein are highly important. Suppose I am giving you a classical example for the weight reduction. Some people are doing intermittent fasting, some people are doing keto diet, and some people are doing the weight reduction diet. But our IDA guidelines and the other IDA guidelines says the VLCD, like very low calorie diet, is not recommended. We shouldn't any kind of diet below 800 kilocalorie, because it can increases the gallbladder stone formation, renal calculi, and simultaneously it can happen hyperuricemia. Why? Because if carbohydrate is not there, what will happen? Neoglucogenesis will happen. Our stored protein can destroy, our stored fat can destroy. Too much of fat destruction will increase lot of cholesterol, and lot of cholesterol increase lot of problematic of the like gallstone formation. So this is shouldn't be happening. That's why the energy production through oxidation is very important. In that cases we are talking about the different oxidations and mitochondrial aspect are very much important. So we have to reduce the neoglucogenesis. For that, a balanced nutrition part should be there in our daily diet. Gluconeogenesis for the blood sugar. Now, previous slide please. Gluconeogenesis for the blood sugar regulation. What I have already discussed, when higher amount of the cortisol and higher amount of the catecholamines like adrenaline, noradrenaline, epinephrine, norepinephrine will be there, that time what will happen? The neoglucogenesis will happen. But our objective to reduce the neoglucogenesis and to increase about all the oxidations and the other process. And synthesis of the immunocomponents, plasma protein, hormone and enzyme. Immunocomponents are very important. We all talk about tumor necrosis factor alpha. We are talking about the other cytokines. We are talking about the IL-6 and IL-7. All are very important immunonutrients and antibodies mechanism that can depend on the protein. So amino acid intake from the diet are very important, because hardly we talk about the branch chain amino acid, that is valine, leucine, isoleucine. We talk about the aromatic amino acid, phenylalanine, tryptophan, tyrosine. So all are very important. Sulfur containing amino acid like cysteine, methionine. So all are important amino acid. What are these amino acid? Nothing but the protein. So protein should be there for the muscle development, for their bone development, for their overall hormonal and the enzymatic activity depends on the protein. If we talk about the peptide base basically in our stomach is depends on the protein. So protein digestion starts from the stomach itself. So all about the protein are very important. The role of protein that we need to understand. Next. Lifestyle factors on the muscle. So decreased muscle protein synthesis to the cigarette smoking, insufficient energy in the protein intake, increased muscle protein degradation, decreased muscle functions and the quality, loss of skeletal muscle mass, strength and the function, and vitamin D deficiency all will happen. Maybe our iron deficiency can happen. Iron deficiency, what we can do? We can give the iron supplementation. What we can do? We can give a lot of animal supplements to the patient, like fish, like chicken to the meat. Sometimes we forget about the main part of the hemoglobin, the globin part. What the globin stands for? Globin stands for protein. So if protein is not there, how come the micronutrients work? Because iron, vitamin C, all are the micronutrients. But if protein is not there, we are not taking the adequate amount of the protein, micronutrients will can't work. So in that cases, again protein plays a major and the holistic role for this mechanism. So this is very much important. Next slide please. Protein, calcium, vitamin D in the musculoskeletal health, role of the muscle growth, physiology, the metabolism. Calcium is a very important parameter on these cases where you can go for the total the skeletal structure, and vitamin D3 the growth of the muscle cells, controlling the calcium homeostasis with the other muscle tissues. Where you can see a patient is suffering from the CKD, chronic kidney disease or acute kidney injury. What will happen? We are suffering from anemia. Why? Due to loss of this erythropoietin level, because erythropoietin increases lot of iron function. What will happen? Vitamin D deficiency. Maybe a madam will be there prescribing one kind of vitamin D3 supplementation. Why? Because of the vitamin D3 deficiency happen, because protein balance will be lower in that particular case. So all things that depends on the protein. At least post the age of 35 undergo the degenerative changes because diminish the tissue repair capacity, functional capacity of the bones, muscles and the joints. So this is the very important part we should take care of. Next. Now gut wellness and its role in the nutrient absorption. Next slide please. What is the gut? Gut is talking about the large intestine. We all know very well, unlike the other parts of our digestive or alimentary canal system, our large intestine doesn't have any kind of enzyme. So gut microbiota plays a major role for the gut health activity. In that cases, we do talk about the effective digestion absorptions, improves gut motility. After the villi and all those things patterns, we are talking about the large intestine, the large colonic pattern, where we are talking about the fructooligosaccharides, which are the prebiotics, and simultaneously probiotics, which are bifidobacterium and other rhamnosus, lactobacillus, all are because in the diet we are getting from the curd. But again, the bioactive form doesn't have in the curd. So all the time we should take anything should be from the proper bioactive form. So this is the very important thing where the functional gastrointestinal disorders can happen. And nowadays people are lot of taking with the what I can say like proton pump inhibitors, H2 blocker antagonists. So dysbiosis happen sometimes. So gut microbiota and gut health should be a major parameter we should take care of. Percentage digestive issues such as gas, such as bloating, such as abdominal pain, and also the gut motility can happen, and also the constipation. Sometimes patient suffers from the constipation. I'll come in the another role where it can attenuate constipation and other metabolic parts. So over time, these changes may contribute to the development of the irritable bowel syndrome. What we can see, if any kind of irritation or inflammation happens in our large intestine or ulcerative colitis from the mouth to anus, any kind of inflammations happen, this is Crohn's disease or Crohn's disorders. Next. So role of gut microbiota, synthesis vitamins and the amino acid for the metabolism part, providing energy for the host protection the immune system, inhibits growth of the pathogenic bacteria, produces antimicrobial compounds preventing colonization by pathogens, and prevents allergens by modulating the immune system to respond proportionally to the adjuvants. Gut muscle axis, where the short-chain fatty acid plays a major role and reduces the translocation of the pro-inflammatory molecules, enhancing insulin sensitivity and the muscle. Next. So now prebiotics and probiotics are symbiotics, effects as a holistic and are very proper nuances for the gut health and the gut microbiota. Now prebiotics inhibits pathogen, reduces allergy risk, enhances immune function, alters gut permeability, decreases protein formation, enhances calcium absorption, produces the metabolites and modulations of the probiotics. Now we need to understand what are the prebiotics are. We know very well about the dietary fiber. Dietary fiber plays a major role about the gut microbiota and also the symbiotic mechanism. Why dietary fiber? Because we have two kinds of dietary fiber. Soluble dietary fiber and insoluble dietary fiber. But we all know very well where soluble dietary fiber have a viscous segmentations and have a major role to attenuate cholesterol, attenuate dyslipidemia, and also increases the insulin sensitivity, so diabetes food control. And also what is the role of the insoluble dietary fiber? Like cellulase, which doesn't have the cellulase enzyme like other herbivores. So in the absence of the cellulose will be there, hemicellulose will be there, we can't digest. that kind of insoluble dietary fiber. The role of the insoluble dietary fiber to take in lot of water to the interlumen pressure and having a good stool and increase the stool formation and attenuate constipation. So the both major role, our RDA recommended dietary allowances for India says that 40 grams of dietary fiber we should take on daily basis from our diet. But hardly we can. We are not taking the dietary fiber, we are taking the fruit juice, we are taking the outside any kind of packet food drinks. So hardly we can get the dietary fiber. Mashed vegetables only we can take. We are not having drumstick, we are not having shark in our diet. So for that purposes, we need some nutraceuticals to actually bridge the gap between our losses of the nutrients to intact to help to fulfill the gap of the nutrients are there. Next. So effects of the probiotics of the human health. Probiotics we all know, there's immunomodulation, normalized gut microbiota and the metabolic effects. Probiotics are the beneficial bacteria present in our large intestine. They are lactobacillus, they are bifidobacterium, they are lactobacillus acidophilus, rhamnosus. There are a lot of specific, I will come to clinical trials, so you will get to know how the importance with the randomized control trials are there. So we increase the gut motility and good about the gut health. Next. So the prebiotics and probiotics are regulating the intestinal microflora, induce good digestive protease and the peptidase activity, improve small peptides and amino acid absorption, reduce harmful protein fermentation, and influence the dietary protein digestion and the utilization. We have to digest the protein. At the X amount of the protein we need. Basically, suppose we are taking chicken, we are taking too much of mutton or red meat, but how do we digest? Because all these things happen, lot of elastin digestion lead a good amount of the pH that can digest properly. If the notch pH is there, what will happen? Abdominal cramp, nausea, vomiting and other things. That's why during this summer, due to less of the slow of the set point, we are trying to have restrict to the chicken and a lot of red meat and other parameters in our diet. Okay, next slide please. This is the very important slide, healthy gut and the protein absorption, the gut muscle axis. This is a very important slide because gut muscle axis and gut brain axis are very important part that we can see the short chain fatty acid as a mechanism. So I am saying the mechanism, what will happen basically for the gut microbiota and other things will happen if we have the resistant maltodextrin. Resistant maltodextrin and the resistant starch like amylopectin and all those things we can't absorb, it can't digest in our small intestine. It can directly goes to our large intestine. From the large colonic epithelium, what will happen? They are increasing short chain fatty acid. What are the short chain fatty acid? Propionate, butyrate. Especially we focus on the butyrate. After having the butyrate, what will do? They will do the gut colonic epithelium and with the beneficial bacteria like probiotics, and they will actually get to connect with the probiotics and prebiotics and will actually help as a symbiotics will be there and which is actually what they do which is actually Dr. Nigala. Oh, Bollywood से which is I can do with you. It's okay, fine. Okay. So that's what I'm saying about the amylopectin and all those things, which is actually working with the symbiotics effects. So what we will do? These prebiotics and probiotics working together as a symbiotic. Now your questions could be there. After having this butyric acid, there could be a gas formation will be there because it can increase lot of H2S, lot of methane, and lot of carbon dioxide. But this is something the formula having a good amount of the digested form of these probiotics and prebiotics and good amount of fructooligosaccharides. These things can happen. This is the proper mechanism where we can talk about the resistant maltodextrin in detail. Next slide. Highlights on the bacillus coagulans. So next slide please. So we can see the anal gut health. alleviates abdominal pain, normalize movements and mitigate the overall symptoms of the adults with the irritable bowel syndrome, functional constipation. Muscle strength, augment muscle strength and optimize protein absorption. Why? Because this bacillus coagulans unique IS2 plus the whey protein concentrate. Whey protein concentrate is the major parameter for the muscle power and the plasma amino acid level. We are talking about the branch chain amino acid BCAA, which contain the leucine, isoleucine and valine. Next slide. So research and safety will say the robust survival rates and rigorous toxicity studies, the comprehensive toxicity studies demonstrate the safety of the human consumption. Not treatment-related changes. Animal studies demonstrate that there is a clinical signs, body weight, food intake, or the histopathology. No adverse events. After having this thing, there is no adverse event monitored, and also there no adverse events is there, and absence of the bacterial infection like infectivity, pathogenicity, increase in the peripheral blood, neutrophil, and the eosinophils. Next slide, please. Properties of the coagulants unique stick, where it is the resistant nature, digestive enzymes will be there, antimicrobial properties like synthesized antimicrobial compound supporting the health of the gut microbiome, vitamin synthesis capable of the producing vitamins, contributes to overall nutrition balance and has promising probiotic potential, offering the benefits of the gastrointestinal health. So clinical evidence shows this is a study where we can see there are two kinds of study. They say the supplementation of the bacillus coagulans with the whey protein in the increase of the branch in amino acid absorption improve the muscle power in the lower body, suggestive of the positive effect of the probiotic of the protein utilization and the exercise performance in the resistant trained males. So we are sometimes with the resistant training exercises. So all those cases we have found the beneficial effect will be there where the muscle power will be much more higher, and sometimes we will go for the positive effect we can give to the performance activity for the sports endurance activities as well as we are doing the resistant training activities. Next slide. Where we can see the conclusion, the bacillus suggested the effectiveness in decreasing the symptoms of the constipation, indicating is an potential effective treatment for the functional constipation in adults. Yes, very good amount of the fructooligosaccharides and prebiotic probiotic effects attenuates constipation. Next slide. Dietary fiber and health benefits. Next slide. Already I have discussed, I am not repeating. Viscous, non-viscous part will be there. You all know very well the part of the dietary fiber which are the pectin, guar, all those things like pectin, guar, and also the other mucilates with the soluble dietary fiber. If you talk about the insulin dietary fiber, those are the cellulose, hemicellulose could be there. So highlights on the fructooligosaccharides will be the prebiotic. So prebiotic are property water soluble, highly hygroscopic, thermally stable, highly stable in the normal range of the food pH, higher viscosity than the sucrose, and sweetness 0.06 times than the sucrose, resistant to hydrolysis by the human digestive enzyme. I am giving you another example where Shukriya madam is there, that we are not talking about the liraglutide, semaglutide, like GLP-1 analogs, medicines, injectable formulas are coming up, already have there. So glucagon like peptide and peptide YY have a very much beneficial help of the reducing of the gastric emptying. His gastric emptying rate will be lower. Automatically a diabetes person will be control their diabetes, obesity person they control their obesity, and also very good for their gut health because there are a lot of medicines are there like the DB4 inhibitors where the linagliptin, vildagliptin, sitagliptin are there, and injectable formulas like semaglutide, liraglutide are there. So these all have the beneficial effect. So the same thing, the same properties are having in the GLP-1 analogs, antagonists, and also the peptide YY having in the lower gastric emptying rate. The same funda, they are not the rocket science, but we need to understand the theoretical aspect for the patient to treat of the patient with the role of the fructooligosaccharides and the probiotics. Next slide. Mode of the actions, promotes growth of the certain microbes with the bifidobacteria, reduces colonic pH, inhibits the growth and the proliferations of the harmful bacteria like Escherichia coli, Streptococcus and the Proteus, reduce production of the toxic metabolites such as ammonia, indole, phenol and the nitrosamines. We all are very much affected nowadays with the kind of what I can say like roasted chicken, roasted meat, lot of amine and nitrosamines will be there which are next to the carcinogenic parameters. So we are talking about this thing. Health of FOS, like short chain fatty acids already I told, prebiotic effect, relief from the constipation, facilitates mineral absorption, and modulations of the immune system. All the IgA, IgE, IgG, IgM, IgE are very much important with all the cytokines and other IL-6 will be there. Very good immunity function. And hinders absorption of the minerals in the small intestine, but releases them during the fermentation in the colon. Already I have talked about resistant maltodextrin, resistant starch, written over there. Next slide please. Clinical evidence. So result, we can see the FOS positively influences the gut bacteria by promoting the growth of the bifidobacteria, reducing the plasma TBORS concentration, basically the butyric acid, with effects with the lasting even of the FOS intake period. So this is a very important study they have done. Next slide. Effects of the FOS concentration, the appearance of FOS increasing the frequency and improving the fecus appearance. FOS can be a viable alternative to the other laxatives of the constipation of the CAPD patient. CAPD basically, we are talking about the continuous ambulatory peritoneal dialysis patient. CAPD patients, they are basically the attenuate constipation. If the stool movement will be higher, so it's good for all the people. So study has been already proposed with the proper RCT. Next slide please. So the highlight, muscle can begin at the early 30 and can accelerate significantly due to the lifestyle factors of the physical inactivity, of the nutrition and the unbalanced diet. So we are always go for the balanced diet. The diet should be proper, the role of the macronutrients, with the role of the micronutrients should be there, with the antioxidants and other phytochemicals. Talking about the protein, calcium, vitamin G, but the primary protein with the muscle mass. We're talking about the branched-chain amino acid, aromatic amino acid, sulfur containing amino acid. Moreover, if in the second bracket, the essential amino acid. Maintaining the healthy gut microbiota, already I have discussed about the role of the prebiotic, probiotic, resistant maltodextrin, resistant starch, with altogether the functions of the digestion, absorption, and the muscle protein synthesis. Higher protein supplementation, including prebiotic, probiotic, can mitigate the muscle, deterioration and other, improving the muscle protein synthesis. And also the study shows the bacillus coagulus, unit IS2 and fructooligosaccharides FOS have been shown that tremendous role for the muscle protein synthesis and overall the gut wellness. The key point that we have to reduce our constipation, we can manage our non-communicable disease like type 2 diabetes, dyslipidemia and other metabolic syndrome X, and also we are trying to reduce with the IBS like irritable bowel syndrome, and also for the sports personality for endurance muscle mass activity, they are also happening with the good effect of the branched-chain amino acid and other important amino acids. So the end point and the end of the conclusion is that protein should be a vital and a pragmatic role in our diet that we shouldn't neglect. We should always be a very good part of the protein in our daily diet, and it starts from the adult side. Apart from their decompensated liver, their chronic kidney disease, acute kidney injury, and other therapeutic conditions. So thank you Zydus Wellness once again for inviting me such a very empirical conference, and thank you Shukriya ma'am, and thank you Dr. Rekha ma'am for sharing. Thank you.